All right, let's start off at the top right here. This is the superficial temporal. All right. Superficial temporal. Here's occipital. And here's facial. So these three are some of the branches off of the external carotid. What's missing is going to be things like posterior auricular. That would probably be around this area. Now, in this area, do not use this for internal external carotid, because honestly, the way they do it, they're backwards and it's not very clear. So don't use that for internal external carotid. You can use it for common carotid. By the way, this one right here is probably the superior thyroid. So here's your right and left common carotids, next to them being the internal jugulars. Okay? So if this is the facial artery, this is the facial vein. Superior temporal artery, superior temporal vein. Occipital artery, occipital vein. So coming here to the heart, you can see the three big branches off of the heart, brachiocephalic trunk. You can't see the split because the internal jugular hides it, but there it is splitting into the subclavian, the right subclavian, and the right common carotid. Here's your left common carotid going all the way up, and here's your left subclavian, which comes up and turns and goes down. So let's do the arm. So this is the subclavian. There are going to be branches which come off, so I think this might be humeral circumflex, these ones. But in this region, basically in the armpit, we'll call that the axillary. So subclavian artery, subclavian vein, axillary artery, axillary vein. When you get past these circumflex arteries, we're going to start calling this artery the brachial. All right? So the brachial, first of all, let's watch it continue, go down, down, down. When it gets just where the radius and the ulna start, you can see it fork. And it's going to form into the lateral radial artery and the medial ulnar artery. And these two arteries right here are the collaterals. So since this is on the thumb side, we call this the radial collateral artery, and this is the ulnar collateral artery. If you look over here, you can see the same thing. We go brachial right here. You can see it splitting into the radial and the ulnar. Okay? So again, this would be radial, and this would be ulnar. And then this is the collateral arteries here. So here's your radial collateral artery. Here's your ulnar collateral artery right there. Now this, remember, this model is anatomical position here, and his hand is flipped over there. In terms of the deep radial, deep brachial, I don't think this model will have it. But remember, there is a deep brachial, and the radial collateral comes off of it. So somewhere maybe around here would be that deep artery, and the radial collateral would come off of it somewhere maybe around this area here. I think that's it. But besides the hand, you've got the palmar arch, the digital arteries. This is the interosseous artery right here, which kind of corresponds, if you think about it in terms of the nervous system, it would correspond to the median nerve, would be around that area too. Going into the abdominal aorta, so what you can't see is the thoracic aorta because that's hidden. But you've got the abdominal aorta here. This is your diaphragm. If you just want to look basically at the lungs here, if this is your pulmonary trunk, right? So this is your right and left pulmonary arteries leading away from the heart into the lungs. These red things would be your pulmonary veins going back towards the heart. Remember, with the heart, do not use vessel color to determine artery and vein. You're going to get in trouble. You can even see the pulmonary semilunar valve right there, and then your atrioventriculars with the chordae tendineae. So this isn't that bad actually for learning some of the structures of the heart. So coming in here to the abdominal aorta, the first big branch we have is the celiac trunk, which is this here. And I think what they do in this model is they have it come up and then branch into its three. So it's supposed to come out at you and then branch into three things. So what I think they've done is they've just taken, it's not a very good job, but there it is, celiac trunk, and this is superior mesenteric. See how close they are to each other? Mm-hmm. Now this celiac trunk branches into three things. Up on the top here, this is left gastric. It's going to go to the left side of the stomach. Splenic, going to the spleen. And this, the only thing that's left over is common hepatic, and it's going to the liver. This common hepatic will branch into a couple different things. One of the branches I think that comes off the common hepatic is the right gastric. So there is a left gastric, and I think maybe this is right gastric right there. I'm guessing. I don't know. Superior mesenteric branches are not shown, but they're going to be things like middle colic, right colic, ileocolic, and you'll have to look at the digestive structures for that. This purple thing right here represents the hepatic portal vein. So this is the splenic vein right there. So splenic artery, splenic vein. And then I think this is probably the union of the inferior and superior mesenteric veins. But these three veins come together to form this thing right here. See how this is going into the liver? That's the hepatic portal vein right there. So coming along, you have the renal arteries right there with renal veins. All right. Oh, by the way, if this is the hepatic portal, these are the two hepatic veins. So this is carrying the dirty blood, so to speak, from the intestines into the liver to get cleaned. And then once it's cleaned, it goes through these two hepatic veins to hook back up with the inferior vena cava. So renal artery, renal vein. Okay. This is a gonadal artery. We don't know whether this is a male or a female, so we'll just call it gonadal. If it's a male, it's a testicular artery. If it's a female, it's an ovarian artery. This right here is the inferior mesenteric, and its branches are things like left colic, sigmoid, superior rectal. Again, you'll have to look at the digestive structures for that. So the abdominal aorta comes down and it forks. The first split is called the common iliac artery, and the veins are common iliac veins. When this big artery branches in, we call this artery, by the way, the internal iliac artery and vein. What's left is the external artery and vein. So this is external iliac artery and external iliac vein. That's after the internal branches in. I think they call this the sacral. So once we see how we're clearing basically the hip, we're up near the head of the femur. This is definitely femoral. This right here is going to be your deep femoral right here. It doesn't have a number on it, but it's deep femoral, and it continues down. So 35, I think on my key I have as deep femoral. Okay. But then you've got this branch which comes off, and this is called the lateral femoral circumflex. Not lateral femoral cutaneous, that's a nerve. So this big trunk called the deep femoral comes off, and the lateral femoral circumflex comes off of it. And so basically the deep femoral sort of forks twice. This is lateral femoral circumflex, deep femoral going down. The lateral femoral circumflex has an ascending branch, and look at that big descending branch, how it goes down the side of the thigh. The deep femoral goes right in the middle, basically right along the femur. It's deep inside the very center of the femur. And then this is your regular femoral. On this side, what's missing on this one, I imagine it might be this, but what's missing on this one is this artery right here. This is known as the descending genicular. So if we do it on this side again, I don't know what this extra, it looks like they've got an extra artery in here, so maybe this is the deep, I don't know what this thing is. It's a mistake. So if this is your deep femoral right here, it's going to keep going down. So this is, again, deep femoral. This is lateral femoral circumflex, ascending branch, descending branch. I have absolutely no idea what this is. Don't know what it is. So this, though, is the femoral artery. You see how they've cut a piece of it away? This is, if this is lateral femoral circumflex, this is medial femoral circumflex. No point in calling something lateral femoral circumflex if there's no medial. That's what that is. It's hidden on this. It's actually right here on this. So lateral femoral circumflex here, medial femoral circumflex, and deep femoral. And like I said, what's missing on this side is this artery here, which is called the descending genicular. Around the knee, we can call these the genicular arteries of the knee. There are several of them. So to minimize confusion, let's just call them genicular arteries. This guy is standing almost in first position in ballet, so this foot's coming straight at you, but this one's off to the side, so you can see the back of the knee. So in the back of the knee, we're going to call it the popliteal artery. Okay? And then you have basically the popliteal splits. It splits into a common peroneal, which, like the nerve, is coming around the front of the leg and is going to go right down the fibula. You could also call this common fibular. What's left is this one right here, which is basically the tibial artery here. Okay? According to the key, this is known as the anterior tibial artery. Okay? This one, I don't know what, maybe this is posterior tibial artery. I'm not really sure what this is going to be, but according to the key, basically what's left over after the fibular comes off is the tibial. All right? And there is an anterior and there is a posterior tibial. I don't think the key does, the model does a great job
If anything, I would probably call this posterior tibial and call that anterior tibial, because look how it comes around front. So I'll check to see whether this key from the manufacturer is wrong, but if I had to take a guess, I'd probably call this posterior tibial, call this anterior tibial, because it comes around the front. 44 on the key is dorsalis pedis, which is the top of the foot, and I think we're going to call this one the deep plantar, right there, because it basically is going along the plantar arch of the foot. In terms of veins, they don't really have that many numbers to them, but there's a deep femoral artery, so there's a deep femoral vein. Lateral femoral circumflex artery, lateral femoral circumflex vein. Descending branch, ascending branch. In the arm, you've got your brachial, right? And then you've got your basilic and your cephalic. I think this, remember, this is basilic and that's cephalic. Am I right? I think I'm right. Always get those mixed up. But you see how brachial's cut away. The confusing thing is that for the veins, do yourself a favor and look down around the wrist. This is radial and this is ulnar. Okay? This is strange because what they should be showing you is something called the medial cubital vein, which is what you actually target with the needle. But there's a lot of variation in the veins around the elbow. Something like 30% of the population will be different in terms of where their median cubital vein is. So I think in terms of refer to the diagram. I can't remember what I call all of these offhand. But I think that's it. Oh, the great saphenous vein, right? So this is the femoral artery, femoral vein, and this one becomes the great saphenous vein that goes all the way down the leg. This one, by the way, is what they use frequently for bypass operations. They'll cut a piece out of this, and they'll use this for coronary bypass. But that's the big saphenous, great saphenous vein. And I think that's it.